Okay, hi everyone. I'm Alexis Williams. I'm one of the co-founders of Business Skills for Health Professionals. And welcome to our first ever podcast. It's called Beyond Clinical. So we're going to be interviewing health professionals who've made career transitions into unique areas of business and industry and really just moved beyond clinical. So we'll be hearing their stories and getting their tips, and hopefully that will inspire you to pursue non-traditional careers. Business Skills for Health Professionals is here to help you with courses, coaching, and community to empower you to become more business savvy and feel confident pursuing unique careers. So I'd like to introduce my first guest, Kristen Sunstrum. Thanks for being the first guest. Kristen is a registered dietitian and a graduate of McGill University in Montreal, Quebec in Canada. She's currently a solutions expert in the area of wellness at a company called Dialogue, a Canadian virtual care company and wellness company that focuses in the employer space. So I'll let Kristen share more about her journey. So welcome, Kristen, and let's dive in.
Hi. Thank you so much, Alexis, for having me. It's so nice to be here. So I'm really looking forward to chatting a little bit more about, my career, but also looking forward to, further guests that you'll have in your podcast, because I think this is such an interesting kind of conversation for us all to be having about different, career paths that we can be pursuing as healthcare professionals. So thank you.
Yeah, thanks for being here. So let's start off with a fun question to warm us up a little bit. What's something that you have coming up this fall that you're excited about? It doesn't have to be work related. Yeah, I'd love to hear.
Yeah, for sure. Well, I think first it's just coming to terms that summer's over. There's a bit of a grieving period, that's my favorite season.
Yes.
But I think as you can relate, we're both dietitians, is that fall is the best, for cooking, for baking, it's just kind of fall
Mm-hmm.
season, different flavors. So I recently bought this new cookbook. It's called Pizza Wine Salad. I'm not sure if you've
Ooh.
heard of it. So I'm just going to try to be making some new recipes, but I don't have any big plans, other than that, just, really time to kind of stay in a bit more, which I'm looking forward to, which
Yeah,
should be fun. Yeah.
that's awesome. Working your way through a new cookbook. I love that as a goal.
Exactly. It's easy. It's cheap. You do it at home. So yeah,
Yeah,
those
great.
are my nothing super exciting, but that's kind of always something fun to kind of do when the cooler weather comes
Yeah.
around.
Nice. So I'd love it if you could tell us a little bit about your career path and your journey as a health professional kind of into more of a business setting.
Yeah, absolutely. More than happy to. So I think if I go back to, why I decided to pursue a degree, in nutrition and dietetics, I think it's something that a lot of people can probably relate to, is that you pursue a degree based off what your interests are, so mine being, as you can probably tell, is, I love food, I love cooking, love nutrition, also fascinated by healthcare. So that was always something that I was drawn to, the field of dietetics, nutrition, and kind of that area. When I was pursuing, my degree, I loved the kind of the subject matter that we were learning, nutrition, biochemistry, physiology, clinical nutrition, and, its application. It was something that I loved to do. I kind of couldn't get enough of it. But then something that I noticed is when I would do my first clinical internships, that I had, all this knowledge that I was so passionate about. I couldn't wait to now go and take everything that I learned in the classroom and then go speak to patients, go speak to, my dietitian preceptor about. And I very much started to realize that the application in clinical practice, at least in my experience, made me feel a bit limited. It seemed to be about, okay, let's see as many patients as possible. Let's ask not that many questions, and let's, prescribe nutrition supplements, and kind of let's get on with it a little bit, is how I felt. And this is, again,
Mm.
just my own experience. Others felt differently as well. And so I kind of felt like I had all this knowledge, but not the right place to apply it. So then I'm sure, as you can appreciate, the great thing about the dietetics curriculum in Canada and the program is that there's a clinical track, and that's obviously the main focus, but there's also a management track. So I felt like when we were kind of speaking about now the application of nutrition and healthcare and organizations, so for example, in food industry, kind of similar to, your career, Alexis, which was so incredible and really inspiring being at Loblaws, but also maybe in a pharmaceutical company, or maybe it's in healthcare leadership, that's something that always really appealed to me. I'm like, okay, I know I have the foundations. Now, where do I go and apply that? But then, as I'm sure you can probably appreciate as well, there's not a ton of entry level career opportunities if that's the path that you want to take. Usually if you're looking for roles in industry, it's very much, okay, you need to have 5 to 7 years as a program manager, maybe at a hospital, maybe at a clinic. And so there was definitely these, kind of questions that I had where I was like, if I even want to do this after I graduate, what's my next step? It was a little bit of a black box, and that was kind of a little bit scary, to not know.
Yeah.
And I'm not sure, did you kind of feel like that too when you were in school a little bit? Did you always know that you wanted to do something a bit more in industry, or?
I did. Yeah. And you're right. Like I hear this a lot from clients that they don't know where to get started. If they're coming out of school and they know they want to be in maybe a different track of the profession, it's like, yeah, what do you even look for? And how do you kind of get started? My experience was a bit different because I did work clinical for kind of 5 years, but I did do some entrepreneur work on the side. So that kind of helped with, I guess, keeping my business acumen and passion alive. But yeah, it is a challenging way to kind of know that you want to go somewhere and not know how to get there. So how did you, I guess, like kind of, make that transition?
So I think it's interesting. Like when things started to change and become a little bit more clearer was actually, interestingly enough, when the pandemic hit. So, so I was still finishing my studies at that time, but then all of a sudden I started to see this new kind of industry that I never really, kind of like noticed before or thought too much about, which is really digital health and health technology companies. So now that, the traditional healthcare system was becoming overwhelmed, that you couldn't, go in and see your doctor because their clinics were shuttered or whatnot. There was all these digital health companies that were kind of coming into the spotlight and solving some of these challenges. And this was something that I just thought was so cool. I was like, hey, like technology fascinates me, health fascinates me. Why not go work for a health technology company? That was kind of my main mission. And so I'm kind of a bit of like an opportunist person. So when the pandemic hit, all my clinical internships were actually canceled in the summer. So I just reached out to every single digital health company that I could find basically in Canada and asked them for
Amazing.
an internship. Yeah, I was like, hey, like I'm a dietetic student. Like I have a lot of knowledge in the physical healthcare world. I'm sure I can add some value in the digital healthcare world, right? How hard could it be was really kind of what I thought. And it's interesting because again, it was harder than I thought, because these, internship applications or even for entry-level positions, they weren't looking for people with a healthcare background. They're looking people with a business background. So I really had to kind of, sell myself a little bit. I had to kind of look inwards and say, okay, I have a lot of these core healthcare professional skills, but how do those translate into the business world in this industry that I really want to work in? So, and kind of coming full circle is, and I'll share another challenge and something that I find really fascinating. When I was then digging a little bit deeper into some digital health companies, I started to notice that some of them didn't value healthcare leadership.
Yes.
They ended up not being really a healthcare technology company. They were just a technology company that happened to have, a wellness or a health product. So all of a sudden I saw digital health companies in kind of two different streams.
Gotcha.
So I decided, if I'm going to work for a healthcare company, it has to be the ones that value healthcare professions and professionals, that they, adhere to evidence-based guidelines, that this is like the core of their values and identity. And that's where I want to be and where I want to work for. So that led me to getting, a position actually at a small startup. So it was called Quinoa, and it was a mobile food application created for dietitians by dietitians. And it's funny enough, Alexis, I think that's where we
Yeah, that's
first
how we met.
connected. Yeah. And this was like 3 years ago or so. Um, Maybe for the audience, we can explain that just really,
Yeah,
really
sure.
quickly.
So
Yeah.
I was working at Loblaw and we were looking at innovative ways to help our dietitians help customers more effectively. So we were hearing from different vendors in the space of like taking photos of food for food, collecting food records. And yeah, Quinoa was one of the companies that and I met you there. So that was a really
Yeah.
cool experience.
Yeah. And it's such a cool full circle moment. But I think that's where I was like, that's also where a light bulb kind of went off in my head when I was working at Quinoa. And then also I met you and I was like, oh, wait, there are other, dietitians, like healthcare
Mm.
professionals that are working in kind of these corporate spaces. And like, look how great this is. Like, there's experts in nutrition that are working on this technology platform that are now helping, dietitians in, at Loblaws and retail food grocery stores now increase the impact that their dietitians have on the population. It's kind of cool to see that come full
Yeah.
circle. And that's, I guess, like where I decided that this was like 100% what I wanted to do. So I was doing a lot of sales and marketing strategies for Quinoa, and I just loved it. I was like, finally, I feel like I've found the right application of my knowledge. And like, it's still like challenging. It's still, you have to stay up to date on, all of your continuing education. You need to understand the challenges that you're trying to solve for, consumers, through, again, nutrition and healthcare.
Yeah.
And that's where that education comes in. So again, that's kind of where it was really pivotal. It like really solidified. I'm like, this is what I want to do. I want to be a dietitian first and foremost, but work with health technology companies, and not just any health technology companies, those that really value, again, evidence-based practices, and, the opinion and expertise of healthcare professionals. So that's what
Yeah.
led me to my current role in my current position. And I'm really grateful for like everything that happened and the way it did, or else I don't think I would be so, strong or like so confident in what I want to do if I didn't go through kind of all these experiences. So
Yeah, that's really interesting. I think there's a lot of great advice there, or just great tidbits around like putting yourself out there, learning the companies so that you kind of understand their business model. That's something I talk a lot about, the need to really understand a company before you go and interview with them, before you even pursue them. Because like you said, like not every company in this space is one that you would really want to get behind. So that's a very interesting tip, I think, that any health professional can definitely look at. So what do you think like kind of helped you along this journey the most, or what kind of things were helpful?
yeah, I think there's kind of two things. So if I think of like the experience that I did before, kind of I started my professional career, and then also, during that time as well. So if I think of, during my undergraduate kind of experience, I was really focused on kind of, I don't think I realized it on the time, but like the leadership skills that I gained with some of the extracurriculars I was doing translated really well in the corporate world, which I wasn't really expecting.
Oh,
So
cool.
yeah, I was like really involved on like campus with like networking events with organizations. And I just kind of didn't realize how some of these leadership skills, like managing a team, or maybe you're doing an event on campus and you have to promote it, and you have to sell tickets. How are you going to do that? There's a lot of skills that translate with, which then helped me make my case for getting that first position. It's like, oh, I do have some of this, business management experience because of these extra kind of things
Yeah.
I was doing on the side. And that also helped me try to build my network too when I was in school, and also when I was then going out to try to get my first job. So that definitely really helped. And so whether or not you're in school or not, there's still always opportunities to be involved in, networking groups, even like yours as well. Like that's a big help as well. And seeking, kind of those leadership opportunities if you can. But then I think another thing that really helped me, and we kind of mentioned this a little bit earlier, is I just had to really stay like focused on like what I wanted. Like when there's so many options for you as a dietitian, it can start to become overwhelming. You're like, wait, like, am I making the wrong choice by not going into clinical, by not going
Right.
into research, by not maybe, I don't know, getting an advanced degree and becoming a PhD researcher? It can be kind of distracting. And like you see a lot of your peers like excelling or taking those like those, you know, those paths. And it's not like they put any pressure on me, is more me putting pressure on
Yeah.
myself. So I was like, okay, I to be successful, I just need to focus on what I'm good at and just try to get really, really good at that and stay true to my interest. And this will help me along my way. So I'm
Yeah.
glad I did, but it was, yeah, it wasn't always easy to, you know, to know if I was on the right path or not.
I think that's really a great tip. And it's incredible that you were able to find that focus quite early on in your career. I really admire that. I think that's something I've personally always struggled with a bit is focus. I'm always, dabbling in a lot of different things, but I think there's a lot of value in kind of keeping that area that you're really interested in and learning and networking with such a focus that it helps you just find those opportunities that maybe wouldn't normally exist if you weren't really, pulling off the layers to see what's there. I also really appreciated you talking about the leadership experience that you got through non-traditional channels. That's something I really encourage clients to reflect on is what are other ways you can get that experience, like you said, through like university committees, events, running events, things like that. Like that all really helps you have experience and examples to talk about when you do go to, maybe apply for a leadership role that you don't have specific job manager experience in. So that's a really great tip. Anything like in terms of skills that you feel like you've learned so far along the way, what have been some of those top skills?
So I'm kind of like thinking about skills is like, and I think this is again in the spirit of like those that are listening and like this being healthcare professionals, is that we already have so many amazing skills that we learn, that we're practicing, that just need to be translated into, the corporate world. So I think it was like understanding like what do I have? And of course, always iterating and building on those, but how can I make that make sense in the roles when I'm not working with patients one-on-one?
Yeah.
So I think like one that I really had to, I guess, learn more and like appreciate is like active listening and those counseling skills. Like, when we're learning that kind of in school, and it's, when you first go and see a patient, you're not just going to dump all of your knowledge on them right away and say, this is exactly what you need. You're always going to take the time to say, hey, what brings you in here? How can I be helpful? And the same things applies, when you're working with a client or with a prospect, it's always like, hey, like, what brings you in? How can I be helpful? And I find that that really translates really well. And that's a skill that I have to like continue to build on. But it's one that I knew of, that I knew I had.
Yeah.
I just haven't seen it, I guess, manifest itself when you're not working in clinical one-on-one. So that's like,
Yeah.
yeah, it's really fascinating.
I think that kind of solidifies like two things I teach about. One being that motivational interviewing is very similar to coaching. So when you're counseling with the MI skills with patients, that actually translates really well to leadership. If you have team members that you're managing, using the same approach to, active listening and not always jumping to give advice, helping people problem solve, like that is so similar. That was one of my big learnings. As I started taking more leadership coaches, or courses, I'm like, this is really familiar. I feel
Right.
like I've learned this. And also, similarly with communication, right? Like learning how to communicate effectively. That can be, you don't want to overload people with information, but you also don't want to do that in a business setting either. You have to have your key messages and be concise. So yeah, those are really interesting. I love the transferability of how you realize that and you were able to capitalize on that.
Yeah, and that's exactly it. I think the piece that you mentioned too about communication is so key. Like when you're working in a corporate setting, it's all about working with people, and working in teams and like problem solving. So those skills that you learn with communication, they go a long way. And the one that I always think of that I think actually healthcare professionals are really well positioned is knowledge translation. So making things that are really complex, simple, and that really helps when you're trying to convey your ideas or your solutions, or even in sales too, because I do work in sales. I work with our sales team a lot. It's how can you take a really complex problem and all the different solutions that someone could choose from and translate that into something that's really simple and conveys value. And like there's almost like one example that I think of, like when you're meeting with a patient, let's say in a clinical perspective, and this patient has type 2 diabetes, and that to help them, solve their challenge is that they should eat more fiber. The way that we explain that to patients, we're not saying like, oh, you need to intake your fiber, like increase your intake of fiber so you can reduce postprandial glucose and like decrease gastric emptying. And that's going to go like so over their head. They're going to be like, what? Like, okay, I'm probably not going to do that. But instead it's like, we know what it does, but we tell the patient, hey, just try to eat more, vegetables, then you're going to be able to maybe reduce your medication intake. Like we have a good way of filtering out the details to convey the value. And I think it's something that's really underrated. And it's been fascinating, like applying that in different settings and just trying to make things simple for everyone to understand.
Yeah, absolutely. I think it also makes me think about like true customer centricity, right? So that's a business term that gets thrown around. And the first time I heard it, I was like, oh, I didn't even know what that means. And, obviously I studied a bit and then I thought this is exactly the same as providing patient-centered care. So patient-centered care being like taking into account the knowledge level of the patient and, what are the factors in their life and how do you adapt your care plan with all those things to consider. Very similar in a business setting to thinking about how do I solve a customer's problem? You're taking into account their situation. So yeah, I love this area of transferable skills. I think you're definitely onto something with leveraging all the ones that you've learned. So I highly encourage that.
Yeah, absolutely. It's so fascinating. Yeah, it's something that it was probably one of the biggest surprises to me, like seeing that the transferable skills, seeing that how it can apply. And yeah, what you said with patient centricity and again, customer centricity is, I'll say what kind of one last piece, and this is again something that I've noticed, is that it's not so much about how much and like how much of an expert you are. It's more how much do you understand, your client's needs. And that's exactly what you do with patients. Like that's you have to be able to do that. So if you can do that today, then you can do that, of course, with others and with clients. So it's like a human skill that's, I think, just so important too.
Oh, that's great. I think these can be really empowering to people that maybe don't feel like they know enough about business to just think of how their current skills can really translate. So thank you for I think that was a great conversation highlighting a few of those. What would you say have been your biggest kind of challenges in your journey so far?
I think kind of as I walked through, kind of my journey, something I touched on a lot is there was always like not knowing like what that next step was. Like that was always a bit of a challenge. And then, but also even when I did, there was a little bit of almost like not a pushback, but when I was trying to make that transition from clinical to business, sometimes I would be questioned almost by hiring managers. They're like, wait, are you serious about this? Like, are you just going to go back to a clinical position after? Like, they really want to know that you're dedicated to that. And so kind of that being said, I think the work that you do is really, really important because it focuses on that transitional period, like not just, again, selling yourself, but then also how do you kind of, I guess, make that long-term plan, or how do you convey that when you're trying to get a first job that's in a bit of a career transition. So yeah, I did receive some like hard questions, and and I was like kind of caught off guard. I was like, wait, but isn't this just a healthcare again, a digital healthcare company. I've worked in the physical world. Like
Yeah.
what's the big deal? So yeah, it was really interesting and a bit challenging there for sure.
Yeah. Well, it sounds like you were able to kind of navigate it, which is pretty awesome. But yeah, it can be, I think that's part of it too, is helping companies understand how they can benefit from having health professionals working for them and helping them understand these transferable skills too. Like we have to kind of make that obvious to them. And it might not always be like, they might not think, oh, like hiring a dietitian or working on a digital health app. Why would I do that? Why wouldn't I hire like a product manager, someone with extensive product management experience? So I think it is really looking at, how can we help those companies see the value as well? And that's definitely one of the things we try to do in business skills for health professionals. But if you could really give any advice to someone who is even further back in their career, like starting out, or maybe somebody that's been in clinical for like 10, 15 years, that just is like, I need a change. I feel like I want to have a bit more career growth opportunity. What would be that advice?
Yeah, I think it always starts with just like knowing that you're not alone, like you're not the only
Yeah.
one that feels this way. Like it's not bad or weird to feel like you want to transition, that you want to challenge yourself in a different way. And I think like it's always connecting with like-minded individuals, like people that have
Mm-hmm.
gone through it or that are thinking of it. So whether that's a conversation with you, with me, through your network as well, I think that's like the first place to start. And that was also, definitely something that I did, like tried to network on LinkedIn, and I would put in
Mm-hmm.
keywords like science background or healthcare
Mm.
background and technology, and I did find a couple people and I spoke to them. That was like one thing that really helped me. And then I think the other thing is, we already like talked about this, but I think it's normal to feel like very imposter syndrome, or really like overwhelming, of like, oh my gosh, like there's no way I know enough about business or technology or this corporate side of the industry that I want to work in. But as we just kind of spoke about, like you already have the skills. It's like being really confident in the
Mm-hmm.
value that you have and that you can provide to an organization, and not like feeling any less because you haven't
Mm-hmm.
worked in a business environment. Like you bring this
Mm-hmm.
entire new set of skills that are transferable, but also perspective that's so invaluable, and you should be at an advantage in my opinion.
Mm-hmm.
And it's, should give you the confidence that there is a need for this, and it's an exciting kind of path
Yeah.
to take, in my opinion. So yeah.
I think that's an interesting one, the imposter syndrome. I certainly experienced that. I would say the biggest area I experienced it was in finance, just
Mhm.
feeling really like a fish out of water. And I think one of the things that really helped me was just remembering that, that's not my area of expertise. And there's people here to support me on that journey. And I just need to ask a lot of questions and be very curious. Just like as a scientist, you bring that curiosity to, maybe like a research setting or, exploring different ways to help patients. You kind of have to bring that into the business world and don't feel concern over asking quote unquote dumb questions. Like just ask them straightforward, and that will be the best way you can learn and grow. And I think that's a really important thing to consider like early on.
No, I couldn't agree more. Yeah, just being curious and being yourself, and asking questions. I also think it's like with business, it's not like one or the other. It's like you learn from like your business colleagues and they make you better, and then also vice versa. And it's just kind of that like yin and yang, maybe, that happens in those healthcare
Yeah.
companies. So
It can be
yeah, it's
very
really
like
cool.
reciprocal, right? You
Hmm.
learn about finance and then the finance person asks you like, how do I increase my fiber? Like that happened all
There
the
you
time to
go.
me.
Yeah.
I think that's like a two-way street that you can really take advantage of. That's an awesome
Yeah.
one.
Yeah. I love that. It's so funny.
Well, Kristen, what are some of your personal development goals for the next little while? Do you have anything on your radar?
So when we say personal development, that's like
Personal
going
or
into work, or
professional?
not.
Yeah, professional, I guess.
I
Yeah.
think maybe professionally, honestly, one of them is to actually network a little bit more. So it's
Yeah.
sometimes something that I do a lot more like internally, at
Hmm.
dialogue at my current employer, but externally, sometimes there isn't, a lot of people that have the same, I guess,
Yeah.
industry or like that kind of experience, which is something that I'm really happy that I connected with you about. And
Yeah.
then another piece as well is learning more a little bit more about kind of public health initiatives and how that relates to health technology. So I think there's
Hmm.
a big trend that's going on right now when it comes to prevention. So is
Hmm.
there kind of an opportunity for health companies to take a role in
Yeah.
some of the preventative spaces? So that's a little bit niche. That's more of like a something that I'm working on. But yeah, I'm always
Yeah.
just kind of curious and doing some research and just kind of looking into that area. So trying to stay on top of that. So
Yeah,
yeah.
those are some good ones. I think it's easy when you get into a company that you're really happy with to forego networking externally.
Hmm.
And if I can look back and say that's one thing I sort of wished I'd done a bit more of. Um, yeah, I mean, the one thing that was valuable about working for a large company is that you end up building a network because everyone moves on to different companies. So now you do have a broader
Hmm.
network. But I think there is still a lot of value in networking outside of your company. And it doesn't have to be overwhelming. Like maybe you just set up like one coffee chat a quarter or month, whatever's like reasonable for you. But yeah, I think
Hmm.
that's a really good tip. Um, is there anything else
Yeah.
you'd like to share with our audience?
Not too much. I think we covered a lot. But I think again, like maybe one piece is when you're going, or I still feel this way, like when you go through these like transitions, is like I think what makes, you unique and special is the experience that you bring and always like trying to keep that identity as, a
Mhm.
healthcare professional first, that's helping a business like solve their challenges has bin really
Mhm.
helpful. And I'm not sure if you feel the same way, but again, sometimes you might experience that a bit of an identity or like imposter.
Yeah.
And I think, it's just like always coming back to, what are my strengths? And it's like, what's my identity? And it's, this knowledge that's being translated in a different way. And it might kind of help with that, some of those feelings.
Yeah, I think one of the things that helps me when I'm feeling like, oh, am I just like a business person now? I'm not really in health is like, no, I think what is really valuable about having people in healthcare backgrounds in businesses is it pushes them to do better, to
Mm-hmm.
make, more evidence-based programs and services and products. And I saw that firsthand. And I'm going to guess that you see that a lot as well. And
Mm-hmm.
that is a big motivator to me because I know that if they didn't have someone with the right, background, maybe that the products wouldn't be as good. So I think there's a lot of value in having healthcare professionals in companies for that reason. So
Exactly. I couldn't agree more, because if it's not you that's in those conversations that has all that expertise and that background, then who is it going to be,
yeah,
So I think
for
it's,
sure.
yeah, it's absolutely something to stay true to.
Awesome. Well, thank you so much, Kristen, for sharing all of your journey with us and your tips. So I really hope everyone enjoyed hearing from Kristen today, and maybe you're feeling a bit inspired. If you want to engage more with our community, please join our Facebook group. I'm going to link it in the show notes, but it's called the Business Skills for Health Professionals Community. It's a private Facebook group. We also have a brand new Beyond Clinical Career Transition program, and that you can learn more by visiting our website, which is www.bizskillsforhps.com, and checking out the services that we have on offer there. So thank you everyone for listening. And thanks again, Kristen. I hope everyone has a great rest of your day.